90%, probably more, of the patients that we see for neck and back issues, we actually don't recommend spine surgery. I go back to the same thing that I tell patients. There are certain patients that no matter what we do, the pain is going to get better with physical therapy, exercises, and time. So with most patients, expectant and observant and conservative treatment works. And sometimes it takes us a couple times to figure out what the right non-operative treatment is for those patients. Of the 10% that end up needing surgery of the patients that we see, or less, we oftentimes have exhausted everything else. So we've tried everything. And so what I tell those patients is, how bad is your pain? How debilitated are you? And what is the amount of surgery that I have to offer you? If it's a simple surgery that can fix your pain and get you back to your function and your work and your sporting activities, that seems to be a no-brainer, especially since you've exhausted all the other options. If there's a neurologic deficit, if someone is weak or dropping things with their hands or their balance is off and it's coming from the spinal cord, or if they've exhausted everything else and they're neurologically deteriorating, those patients need surgery because it's going to affect their function. It's going to affect their quality of life in the future. So oftentimes we reserve surgical options for those patients. And those patients, there's patients who need it, and there's patients who want it because they're in pain and have exhausted everything else. But for the majority of the patients that come to see me, we can offer them non-surgical options and get them better without even talking about the surgical options.